Welcome everybody. I'd like to invite you this afternoon to a very unique session. This is one of the first sessions where we're going to try and do a hands-on workshop with an audience of about 300 people. So I hope you enjoy this afternoon. And we're going to be focusing on bronchial thermoplasty. And as you all probably know, this is a new novel therapy for patients with severe asthma. It's based on the application of radio frequency energy, which is then turned into thermal energy, and the objective is to try and reduce the amount of smooth muscle tissue that these patients with asthma have. Now, why do we need more treatments? Well, as you all know, asthma is becoming more and more prevalent throughout the Western world. In Europe, we've got about 32 million people affected with asthma, and about 6 million of these patients will be classified as having severe asthma. And if you actually look at the cost of treatment, which is quite a huge amount, you will see that more than half of the cost of treatment of asthma is actually occupied by this smaller proportion of patients who have very severe asthma, and they're already on multimodality treatment. And if you look at the kind of the stepwise approach which was first pushed forward by the British Thoracic Society, you can see that those in step 4 and 5 are actually already on maximal medical therapy. And we do need something different, because a lot of these patients, despite being on absolutely maximal medical therapy, are still very symptomatic. So novel therapies in this area are very, very welcome. And the concept with bronchial thermoplasty is that it uses the thermal energy to reduce the amount of smooth muscle bulk. And what we hope in this workshop is we've got some very distinguished speakers who've got a lot of experience with bronchial thermoplasty, and therefore I now take the pleasure of introducing you to Jerry Cox, who's first going to present the sort of long-term effect of asthma control. Thank you, Jerry.
Thank you very much for the opportunity to talk to you this afternoon about the results of the clinical trials completed to date examining bronchial thermoplasty for the treatment of asthma. The clinical trial program began almost 10 years ago, and the first publication was in 2006, where we looked at patients with mild or mild to moderate asthma. The following trial, which was the AIR trial, examined patients with more moderate asthma. This would be step 3 and perhaps 4 on the previous diagram that you saw from Dr. Shah. And then there was a small study in patients with severe asthma, steps 4 and 5 from the previous graph. I will, however, focus most of what I'm going to say this afternoon on the most recently completed trial. This is the AIR2 trial, published last year. And I'll just remind you that there are about 276 patients that have been treated with bronchial thermoplasty over the course of these trials. These have been treated with over 800 procedures. 3 of the publications report randomized controlled trials, and there are a number of other publications, some of which report the longer-term outcomes, and, of course, the feasibility trial, which was not randomized. In the AIR2 trial, this was the pivotal study done in collaboration with the FDA in the USA in order to obtain an indication for use of bronchial thermoplasty to treat asthma. Patients had severe, persistent disease, and they remained symptomatic despite compliance with prescribed medications that included high doses of inhaled corticosteroids and long-acting bronchodilators. The primary outcome was the patient-centered outcome, asthma quality of life questionnaire, and we reported the change in this questionnaire over 1 year after treatment. It's important to point out that this trial of a procedure for the treatment of asthma was sham-controlled. That is, in the placebo group, or the control group, subjects underwent 3 non-therapeutic bronchoscopies. Thus, in the treatment group, everybody stayed on their usual medications and received bronchial thermoplasty, and in the sham group, they stayed on their usual medications and underwent 3 sham procedures. Almost 300 subjects were examined in 30 centers in a number of centers around the world. The initial trial protocol reported outcomes at 1 year, and the primary outcome was an aggregate improvement in quality of life between 3 and 12 months. In addition, those patients who were in the active treatment group were invited to join a follow-up study where the persistence of benefits and the development of longer-term complications could be examined. need to point out that the control subjects were not invited to join this follow-up study. The AIR2 trial reported an improvement in asthma-related quality of life in subjects treated with bronchial thermoplasty. With respect to other outcomes that we are interested in, there was almost one-third reduction in the rate of severe exacerbations that actively treated patients experienced. There were also substantial reductions in the need to attend the emergency room for urgent care and for other indicators of asthma morbidity. All of the studies done with bronchial thermoplasty have examined the safety of the procedure both in the short and longer term. And, in brief, we can say that in the AIR2 trial that there were no unanticipated events that occurred in our patients as a consequence of treatment. In fact, in all of the trials we reported a good safety profile. The AIR2 trial, in addition to showing improvements in quality of life, showed a reduction in healthcare utilization shown on this graph. The reductions in the rates of severe exacerbations and in emergency room visits were both clinically and statistically significant, and there were trends towards reductions in their need for unscheduled physician office visits and in hospitalization rates. For undergoing a procedure like this, with the short-term consequences of increased asthma symptoms in the few days after procedures, it's important to look at whether that upfront cost is related to a longer-term benefit. And so, in all of our trials, we've endeavoured to follow our patients beyond the 1 year of the original follow-up dictated by the protocol. In the AIR2 trial, we've reported the 2-year outcomes in our patients. And here we see that of the 181 patients who completed 1 year, we obtained consent for enrollment from 166. And when we look at the rates of severe exacerbations and emergency room visits, the reduction that was enjoyed by these patients after bronchial thermoplasty at 1 year was continued at 2 years. The rates of hospitalizations have remained low. I'll close by recounting the experiences recently with one of our patients who was quite a typical candidate for bronchial thermoplasty. A younger adult, already treated with maximal doses of inhaled steroids and long-acting beta agonists, who, despite her compliance with these medications, continued to experience significant asthma symptoms on a near daily basis. Her ability to do her work and to enjoy her social life was impaired by her asthma. She was reliant on her asthma medications and could not do without them. In the year prior to her considering bronchial thermoplasty and being enrolled in our study, she had experienced deteriorations of her asthma, severe enough to require attendance at the emergency room and the use of oral corticosteroids. During the treatment phase, that is the 3 treatment bronchoscopies, she did experience a short-term increase in her asthma symptoms after procedure, predominantly cough and wheeze, which lasted a number of days, and this is quite a typical post-procedure experience. Like everybody else, she doesn't report pain. However, at 1 year, she had a marked improvement in her quality of life score. She also had a 10-fold increase in the number of days in which she was free of symptoms, and this was mirrored by a marked reduction in her need for rescue medication use. Now, at 5 years of follow-up, she hasn't experienced a single exacerbation requiring hospitalization or emergency room visit or corticosteroids, and this is in marked contrast to her pre-treatment experience. Her lung function has been stable, and she's been able to enjoy her activity levels and her life to a greater degree. This is the sort of outcome which we would love to see experienced by our patients in whom we consider bronchial thermoplasty.